Hi guys, my name is Kailey Wilson. I'm a pediatrician in the Kansas City area. I'm here just to talk with you guys about some general care for your baby and just important things to know as you're learning to be a parent and just getting used to all of the things that go with that. And we're gonna get started today. If you are breastfeeding your baby, usually your milk will come in around day 4 of life. So I know a lot of times I'll get a lot of questions from moms just about kind of the stress while you're waiting for that milk to come in. How do I know if my baby is getting enough to eat? How do I know if I need to give them additional food or formula just to make sure that they're healthy and safe? So I would say to that, it actually works really well by design that usually even though your milk doesn't fully come in until day 4, baby's stomach is really small and just really tiny. And so in the beginning, your body produces some colostrum, which is really good concentrated breast milk that has a lot of nutrients. It has good fats for baby and just some really good things for them to have from the beginning, antibodies and things like that help them have protection against getting sick. And so baby in the beginning just does great with just that little bit of colostrum. And then as your milk starts to come in, baby's stomach grows and they get used to that. And then they're able to feed more and tolerate that well. So what we're looking for in the time between when baby's born and when your milk comes in to make sure that baby has enough to eat, the main things that we look for are the output that baby has. So we watch those wet diapers. So a really good rule of thumb is looking for number of wet diapers for how many days old. So for example, if baby is 2 days old, we want to make sure that baby has about 2 wet diapers during the day. 3 days old, 3 wet diapers during the day. Usually around day 5 or so, those diapers will just get more and more. So you don't need to worry if you have 10 on day 10, you don't need to keep counting after that. But usually around day 5 is when we see, okay, we're doing good. We don't really need to keep track anymore because we know baby's getting the output. And another thing that your doctor will look at is just making sure that baby's weight isn't down too much. So if they are down more than 10% from their birth weight, that's when we get a little bit worried. Oh, we might be worried about dehydration or just making sure the baby's safe and talk about other ways to get nutrition for baby. But if those things are happening, if they're having good wet diapers and their weight is okay, then it is okay to kind of just let your body work and just keep feeding baby as frequently as you can. So I'm going to talk about if you're formula feeding your baby, knowing how to mix your formula and also knowing how much your baby should be taking. So typically, by around 3 days of age, most babies will be taking about an ounce of formula, which is about 30 milliliters. And usually around 7 days of age, they will bump up to about 2 ounces of formula. Around 2 weeks of age, most babies will be around 2 to 3 ounces. And then around a month of age, most babies will be around 3 to 4 ounces. So that's a general rule of thumb. Some babies do not take that amount. And if your baby was premature or born early, they might be taking a little bit less than that. That is okay. You'll just want to follow closely with your doctor to make sure that they are taking the right amount to gain weight. That's the biggest thing, is that they're gaining weight at this age. So I'm going to show you guys how to use formula and how to mix it. You'll want to make sure that you are reading the directions really closely on the formula. For this formula we're going to use, it's going to be 2 to 1. So if you're doing 2 ounces of water, you're going to do 1 scoop of formula. For this example, we're going to use 4 ounces of water, and so we're using 2 scoops of formula. So I'm going to show you how to do this. You're going to want to make sure, put the water in first and measure that out. So if you want a 4-ounce bottle, you're going to do 4 ounces of water first, and then you're going to get your scoop. And you're just going to want to gently pack it, and I kind of shake it to make sure that it's about at the top. And then you're going to just pour that in. So that's 1 scoop. Since we're doing 4 ounces, we're going to do 2 scoops. So we're going to pour that one in. And then you are going to want to mix it really well. Make sure you don't have any clumps in there. And then if you guys do use a bottle warmer or you warm it up, you're just going to want to make sure that it isn't too warm. So you can test it on your hand, just put a little bit on there, make sure it's not too hot for baby. And then you have your bottle. All right, guys, so now I'm going to talk about spit up. This is also a really common question and something that I think is really good to know about your baby. So with spitting up, it is a normal thing that a lot of babies do. And it is normal because for your baby, They have a little valve to their stomach, and it is just very loose in a newborn. Very common, along with other things that you notice in baby, like you might notice, oh, their shoulders pop a lot, their knees pop when I'm just moving them, and that is okay. These are normal things. Babies are meant to be very bendy and kind of move easily because they're made to come out of the birth canal. So that is normal in your baby, but sometimes it can cause some concern with spit up. So what is normal and what is not? So I would say about 80% of babies do just have this normal spit up that we notice. Most parents, I feel like, don't mention it until we're noticing babies taking, more volume of breast milk or formula. But it is a common thing that we see. If you notice the spit up is happening and it's white, it's sometimes a little bit curdled, that would be normal. Things that we would look for that would be concerning for spit up would be any spit up that is bright green or bright yellow. That would be concerning for an obstruction. And so we would definitely want to know about that. The other thing that we would worry about would be spit up that is persistently projectile. Most parents will have an experience at some point of their baby having a spit up that they would describe as forceful or projectile. Usually it will come with the story of, oh, baby was really hungry and we were feeding really frequently and having a lot of cluster feeds. And then all of a sudden they just threw up and it was just all over me. So this does happen very frequently. Most parents will experience this at least once. But if this is happening very consistently and with every single feed and getting worse with time, especially when baby is in that 3-week to about 8-week period, that's something that we would want you to talk with your doctor about, because that could be a sign of something else going on. If your baby is around 1 month of age and you notice the spit up getting worse and they're having pain with feeds, so you're feeding them and then you notice, oh, all of a sudden they seem to be kind of arching their back with feeds, they're just really fussy, not comfortable, kind of seem stiff, that can be a sign of acid reflux. So that's something else that you would want to talk to your doctor about with that. I did want to show you guys too how to burp a baby correctly. So a good thing to do is have a good burp cloth here, because you don't want to ruin your shirt, because that will happen anyway, but you can at least try to prevent it. So you want to put that there and then have baby up here, just so that you make sure that their head is stable. So when babies are little, they don't have that good head control. So when you're picking them up, you want to make sure you're always holding their head to support their head, because it's very heavy for their body and they just don't have that neck control to hold their head up yet. So you want to make sure you're holding their head, and then you're going to kind of put them on your shoulder, and you're going to want to do a burp. You're going to want to pat between their shoulder blades and just firm. A lot of people are really worried about burping baby, that they're going to be too hard for baby, but if baby is there secure, you're not going to hurt them if you're just burping them very firmly there to get that burp out. I think another important thing to mention that a lot of parents worry about is if your baby doesn't burp, that is worrisome. And I will just say, some babies, it's great if you can get a burp out. A good rule of thumb is to, if you're using formula, about every ounce to just stop and burp your baby. They might get frustrated because they want to just keep eating, but it will help them to decrease gas and keep them more comfortable if you are burping them. If you're breastfeeding, if you switch sides, you can burp them between sides, and that can be helpful too for baby. But not every baby will burp every time, and that is okay. That isn't harmful to them. Some babies are more efficient at feeding and they are not getting as much air, and so they just won't burp. And so that is okay. If you notice that your baby isn't burping as much, that's not harmful to them. It's something to definitely try to see if they need it, but if they don't, it is okay. So I'm going to talk about changing a diaper now and just some general care for that area. So when you're changing your baby's diaper, I'm just going to kind of show you guys how to do that. So we're going to get baby undressed a little bit here. Okay, and then you're gonna have your diaper. So we're just gonna pretend like we have diaper on baby here. So if you do have a girl baby, so it is normal if she does have a little bit of vaginal discharge. So if you notice that when you're wiping, that is normal. And it also would be normal, not common, for baby to have a little bit of like a bloody discharge. Notice sometimes around a couple weeks of age, and this is just from withdrawal of mom's hormones. It isn't harmful, and it is okay if you notice that. It isn't very common, but it can happen. When you're wiping, if you have a girl baby, you're just gonna want to gently wipe, mostly on the outside. If they do have a little bit of that discharge there, you don't have to like wipe out the inside unless there's like stool there that you're trying to remove. Otherwise, it is okay to just gently kind of wipe the outside. If you do have a boy baby, you're gonna wanna think about whether they're circumcised or not circumcised. If they are circumcised, you're gonna wanna just make sure that you're not wiping that area. You wanna just try to avoid wiping it. If there is stool in that area, it is okay if you wanna just get water and drip like a washcloth over that area to gently clean, but we try to avoid just any contact with that area while it's healing. If your baby boy is not circumcised, you do not want to retract the foreskin. You're just gonna kind of gently wipe the outside, and that's all that you need to do. Another thing that I did want to talk about was just a good rule of thumb with diaper care is in the beginning, it's a good idea to just keep a diaper cream, or I personally like Vaseline or Aquaphor, just keeping that in the diaper area when you're changing, because babies have very frequent stools in the beginning and you can be changing their diaper all the time. And that's normal, that's good. That means they're having the output that we want, but it can cause a rash, and it's a lot easier to prevent that rash than to have just this really bad rash. Then it takes a long time to get rid of it. So it works really well to just keep that diaper cream in that area before you're worried about the rash. And usually around a month of age, most babies, their stools will slow down in frequency, and that is normal. It just has to do with changes in their the good bacteria in their gut. So that is okay as long as your baby is still gaining weight well, eating well, and their stools aren't hard. So something that is normal, and then you don't have to worry as much about keeping that cream on. Okay, so I'm gonna talk about swaddling now. Swaddling is your best friend when you have a newborn. It can be a game changer in helping them sleep and keeping them comfortable, because if you think about it, baby is used to being super squished and tight. That's what they're used to. So whenever they are just laying on their back and their arms are out and they're flailing around, they are just uncomfortable, and they have a normal reflex called the Moro reflex that their arms will go up and they get scared, and then they cry, and it just keeps them awake and uncomfortable. So if they are swaddled, it can help them feel comfortable and safe, and they can rest easier. So for swaddling, I like to use a good blanket. If you have one that is kind of stretchy and big, it can help you in your swaddling. And you can do them different ways, but I like to just fold the corner down like this. It makes it easier to know where their head goes. And then you are just gonna place them on this blanket here. And you will get better with this at times. So don't feel like you are not good at it. It just takes a little bit of practice, but anyone can do it. And with time, you're gonna become a pro at swaddling. So I like to just fold baby's arms down like this. Most of them are little Houdinis and they try to get out very quickly. So if you keep their arms flat, it can help you. And then you're going to take one corner of the blanket and just wrap it snugly and tightly. I like to just kind of put it underneath their other side so it's really tight. And then you can use the bottom and kind of fold that part up so their feet are secure in there. One thing I did want to mention is you do want to make sure that it isn't as tight around their hips. So the top, the arms, we want that to be tight, but the hips we want to keep a little bit loose, because baby's hips develop both prenatally, but also when baby, postnatally, when baby is outside of mom, they're still developing for the first year or so. So we want to make sure that we give those hips room to develop, especially when they're sleeping a lot and swaddled a lot. So you want to make sure those are loose. And then you can take the other side and you're just going to tightly wrap the top, keeping the bottom a little bit loose, and then tuck that behind too. And then your baby is swaddled. So I wanted to talk about how to pick up your baby in a safe way. So Sometimes people are afraid to pick up or hold babies because they're worried that they're fragile, which is true, but they're also more resilient than you think. So as long as you're doing it the right way, you're gonna keep babies safe. So when you're picking them up, the biggest thing is you wanna make sure that you're just supporting their head, because babies' heads are really big for their bodies. They kind of grow into them with time, and their neck is not strong. So in the beginning, they are not good at supporting their head. So you're gonna wanna make sure the biggest thing is that you're supporting their head when you're picking them up, and then you're gonna wanna support their bottom too, and just make sure that they are stable when you're picking them up. Another important thing to know about is tummy time, and that is very important for your baby's core strength. It helps them to develop skills so that they can learn how to roll and with time, how to sit up on their own. So one thing that you can do, even when babies are very young and newborn, is when you're kind of spending time with them, you can just have them kind of laying on your chest and their tummy is touching your chest or your tummy. And that helps them to develop that strength. If you're laying down, they're kind of having to hold their head up a little bit, and that is teaching them to engage those muscles and use that strength in a safe way so that you're making sure that they're still able to breathe well and all of those things. As they get older, it is important to start to teach them how to do that on the floor. So a good thing to do is to put a blanket on the floor, something that is soft for them. And a good time to start this is when baby's around 1 month of age. Before that time, it's okay just to do that kind of chest to tummy time when you're holding them. But after that time, babies are starting to get stronger, and it is safe for you to try to put them on the floor to do that. A good rule of thumb is to try to work up to a few minutes, a few times a day of tummy time. So if your baby really is fussy on their stomach and doesn't like it, it is okay. I know it's hard to hear your baby cry, but if it's just for a minute or so, it is okay for them to get used to that. And it is to their benefit so they can learn to be strong and to use those muscles. So when you're gonna put them on tummy time on the floor, you can just gently flip them over. You're gonna wanna support their head in this too, and then you might have to kind of move their arms around a little bit. In the beginning, they might just kind of put their head down and be tired. That's okay. Just encourage them with time to lift it up. And while they're doing that, you're just gonna wanna make sure that you're present and watching them, that they're safe and they're able to breathe and everything like that. But just encourage them to kind of lift their head up. You can kind of lay down with them, just eye level, and just get on their level and just talk with them to try to encourage them to lift that head up, and they're gonna get better with it with time. So how do you know what to put your baby in for clothes? That is something good to know. So a general rule of thumb is if you are comfortable in it, your baby probably is too, plus when they're very young, maybe an additional layer for them. So for example, if you're wearing just a t-shirt, maybe have your baby in a onesie, but then also you can have them in like a thin blanket too over it. So that's a good rule of thumb to know. It is good to make sure that they're staying warm because they're having a harder time regulating their temperature. But usually after the first few days of life, babies are getting better at this. So as long as you have the temperature at a pretty neutral number, so around 70 degrees plus or minus is good for babies, that would be safe for them. One thing to know and be aware of is that babies are more sensitive than adults to changes in extreme temperature. So for example, if it's very hot out or very cold out, you're gonna want to try to limit your time outside or in those conditions with baby, if you can. An important thing to remember is the car. So sometimes that's easy to forget if you're inside in air conditioning, but it's 100 degrees outside and then you're going to the car with baby. If you can, it's a good idea to go ahead and try to cool your car off before you bring baby into it, because even in that short time that you're driving, if it's 100 degrees in your car and it takes a while for your car to cool off, it can be dangerous to baby. So any hot or really cold conditions, it's good to try to neutralize those as much as you can before you have baby in those environments. Okay, so we're gonna demonstrate how to put baby in the car seat safely. First, you are going to want, if you have a carrier, most of them will have this little part here so that you can carry it when you have baby out of the car. But I think it's easier if you kind of close that before you put baby in, because you want to make sure that you don't bonk their head. And then another good thing to do is just to make sure everything is kind of out of the car seat, that you have these straps kind of out of the way so that when you bring baby in, it's easy to just strap them in. You don't have to move them too much. So you're going to pick baby up and support their head, and then you're going to gently place them in the car seat. And then you are going to just use the strap and place it around their arm. And then you can do the other strap too. And then the strap on the bottom, you're going to want to make sure you're really careful when you're doing that you're not pinching their legs as they get bigger. Baby's legs get a little more chunky, and you want to make sure that you're not pinching any part of that skin. And you're going to use this part too. And just do that equally. And then after that, you're going to do this top part. With that, you're going to want to make sure that whenever you go ahead and do that, you tighten it up. And you want it to be snug on baby, but not so tight that they can't breathe. So a good way to tell is if you can kind of stick your finger under there. That is a way to tell that it's not too tight, but you do want it to be tight enough that their body and their head isn't flopping around in the car seat. Some car seats will have like little kind of pads or straps right here, and those are okay, but you just want to make sure that they're positioned so that they're supporting baby's neck in the right spot there. And then you're also going to want to make sure that this stays up like this whenever you have baby in the car seat, just to be safest for them. And you want to make sure that when your car seat is in the car, that it is always backward facing. The reason for that is to prevent head or neck injury for baby. If you guys did get in a wreck, it is safest for them to be backward facing for that. So how do you know when something is wrong with your baby? There are some important things to know, especially in that newborn period, to just know if baby is safe. And so one of the biggest things to watch for in a baby is a fever. You do not need to check your baby's temperature all of the time. It isn't something that you have to continue to do. But if your baby does seem very warm to you, that is a time that we would recommend going ahead and checking their temperature. If you do have to check baby's temperature, the best way to check it and most accurate is with a rectal temperature. The temperatures that check their forehead or under their arms just aren't accurate in babies. There used to be a kind of general rule that, if you check under their arm, you add a degree or certain things like that, but that's actually thought to not be accurate now. And the best way is just to check a rectal temperature in baby. So most of the time the hospital will send you home with a thermometer, and so you have it at home if you do need to use it. And if you felt like your baby was warm or they were just acting strange to you, they weren't wanting to feed, they weren't responding well to you, we would want you to check that temperature, and you would just barely place that thermometer in their bottom to make sure that their temperature isn't high. So fever in a baby is 100.4 Fahrenheit or greater than that. So that is a temperature that we would look out for. In babies, this can be a sign of a serious infection, so it would be something that we would want you to just monitor for. And if it was high, we would recommend you taking them to a pediatric ER if possible, just for best care for baby, just to make sure that they don't have an infection or anything else going on. Another important thing to watch for to make sure that baby is safe is their breathing. So this is a common thing that we see in newborns called periodic breathing. And babies can kind of have some funny breathing, and so it can actually be normal. So I wanted to talk to you about what is normal and what is not normal. So with periodic breathing, babies will sometimes take a few short breaths and then have normal breathing after that. So sometimes it will kind of sound like that, and then they'll just have regular breathing for a little bit, and they might do that again. So that is actually okay if you notice baby doing that. It is just their way of learning how to breathe, and they start to regulate their breathing, and it is safe for them. What would be unsafe or something that we would worry about would be if we notice consistently with time, baby is breathing really fast or really hard or just working to breathe. Babies do have different rates of how fast they're breathing. In the beginning, it is a little bit faster, but if you noticed with time that baby was breathing more than 1 time a second, so you're counting out seconds, 1, 2, and baby is breathing, taking breaths quicker than that, that would be something that if you're noticing that over, an hour, 2 hours, it's persistent, that would be something that we'd want you to contact your medical provider for. If it is very brief that they're doing that, like you're noticing, oh, they did that for, a few seconds and then it went back to normal, that would be okay and most likely consistent with that periodic breathing for baby and okay to monitor. Another thing to watch for with their breathing is just their work of breathing. So a good way to do this, if you're concerned about their breathing, is just to go ahead and just undress them, because the best way is just to look at their chest and their head and how their muscles are moving to see if they're breathing too hard. If you actually completely undress baby, if you're worried about their breathing and you really want to look at their chest. If babies are working too hard to breathe, they're a lot of times going to be pulling in around the muscles of their chest, and we call that retractions. And some babies will do that when they're just like stretching or moving. Sometimes when babies are hungry, they'll briefly do that. If they're just like breathing a little quicker because they're excited to eat and they're hungry, that will happen. But if it's persistent with time, that would be something that we would want to look into. So if you're noticing the pulling in around the ribs, this can happen either between the ribs or under the ribs. So it's just going to look like deep breaths, and then they're pulling in around their ribs. So that's a good thing to look for. The other places that you can look in their head movement. So if they're just laying flat on their back, their stomach should be moving gently with breaths. But if you're noticing that their head is like moving up and down, like they're kind of bobbing their head, trying to take breaths like that, or they're pulling in like around their neck, or sometimes their nose will kind of like the outer part of their nose will what we call flare, like they're trying to get breaths in. So they're doing everything they can to get those breaths in and working hard. That would also be a sign of trouble breathing. So if you notice those signs of trouble breathing that we talked about with the persistent fast breathing or the pulling in around the ribs, just signs that baby's working hard to breathe, that is a medical emergency, and that is a reason to take your baby to the ER. So nasal congestion, or just kind of that kind of a sound when baby is breathing of just kind of, it sounds like they have like a little bit of snot in their nose, that is pretty common in babies and in newborns. And it's something that we usually don't get worried about in and of itself. We would just want to make sure that we monitor those breathing signs. And if you do notice other signs of illness, like baby is having a lot of discharge out of their nose, and then again, we're watching for fever, those would be signs of things that possible illness that we would want you to take your baby to their provider for. But if you are just noticing at home that they do have a little bit of nasal congestion, it is safe, if you want to try to help them with that, to use a bulb suction syringe. So you are going to first squeeze it before you place it in their nose, and then you're going to just gently place it in there, and then you're going to pull it out to get the snot out of their nose. Sometimes you will hear that sound, but you won't be getting a lot out if they're not truly sick and they just kind of have that newborn congestion. That is okay. But if you want to try to help with that more, you can use nasal saline, little drops, and just put a couple drops in each side of their nose and let that sit for a few minutes, and then try the bulb suction again. And sometimes that can help you get a little bit more out. So we're going to talk about normal crying in babies. There is a period of development that we actually found is normal development, and it usually presents around 3 weeks of age and typically will peak by 8 weeks of age. There are a lot of different names for it. You might have heard the witching hour, or purple period crying, or colic is what we used to say like a while ago. So any of those terms, and they're all referring to this period of normal developmental crying that usually happens during that time. So typically it will occur most commonly around in the evening hours. So maybe 7 p.m. to 11 p.m. is a common time that I'll hear, oh, my baby is just really upset during that time. And, I've done the normal things. I've fed them, I've changed them, made sure they're safe, nothing tight wrapped around their hands or feet or anything like that. And they're just upset and they're hard to calm down. So this is actually a period of normal development. And that helped me a lot as a parent too, to know that this is normal. So just trying to hang with them in this period and help them through it. There are some tools that you can use to help you in that time when baby is upset. So we like to use the S's to help us remember those. So some of the S's that you can do. So 1 stands for suck. So if you have a pacifier, you can give that to baby. That just helps them calm down. Another is to swaddle them up, like we had shown you earlier, how to do that tight swaddle. That just helps them feel safe. And another is to kind of gently swing them. and to also place them on their side. So if you kind of have them on their side like this, that can help them feel safe, and it just helps kind of comfort their stomach to be up against yours. And if you're gently swinging them, and then kind of that, even that that sound actually calms baby. It's kind of a natural instinct to do that, to just calm baby with that sound, but it actually helps them because it is very familiar to them, because it's similar to that sound that they hear whenever they're in your womb, that they're hearing that sound of those blood vessels. So it's a very soothing sound to them because it's what they're used to. So another thing that's important to note, if during this time when you're having these crying episodes, it can be really hard as a parent. And one thing that you can do is just, if you feel like you just need a time that you're like, I'm getting upset, I'm getting frustrated about this, it is okay and safe for you to place baby just in a crib in the bassinet, just by themselves, and give yourself some time to calm down with that. If you do have a partner helping you, it can be super helpful to just communicate with them. Hey, I'm feeling overwhelmed. I'm feeling frustrated. I just need a little bit of break, and see if they can kind of clock in and then help with baby so that you can take a little bit of a break. We want to make sure that baby remains safe during these times that they are crying. If you're getting frustrated, the reason we want you to just put them down to be safe is that we want to prevent any danger to baby. So if you get frustrated and you kind of lose your cool and you do shake baby, that can be really harmful for them, both now but also for their future development. So we need to make sure that baby stays safe. So whatever you can do to calm yourself down, to get help from your partner or even a friend, just to give yourself that time to cool off, so that then you can come back to baby and help them and care for them in the way that they need. One thing that helped me a lot as a parent too is remembering that when we are meeting baby's needs and we are helping them when they're crying and feeding them when they're hungry, you are actually creating bonding with that baby, and you are helping them create attachment. And that helps them in this stage of life, but also all throughout their life. So it helped me as a parent to think about, when I am meeting baby's needs, even though I am tired and this is hard, and they are crying again, that I am actually helping them bond with me and create that attachment so that we can have a good relationship through our lives, but also so that they can have that good sense of attachment for other relationships as well. So we're going to talk about safe sleep for baby. So even though it isn't natural for babies to sleep on their back, this is actually the safest way for them to sleep. When they are little and they can't control their airway or protect it, we want to make sure that it's safe. So the safest thing for them is to be flat on their back with a surface that is flat, that doesn't have any other loose blankets or anything else in the crib. We want to avoid crib bumpers or anything like that. And when baby is sleeping, you do not want them in a swing or anything where their head could be sideways, because in a swing, or even if you are leaving them in a car seat, their head can go sideways, and that can actually block their airway, and we don't want to do that. So the safest place for them to be sleeping is to be by themselves in a separate area, flat on their back. So babies will sometimes, in the beginning, you will just notice a lot of sounds coming from baby. They might sound like they're kind of gurgling, or they're just like kind of grunting a lot, and that actually can be normal. Some babies just really are uncomfortable on their back, but with time, they get a lot better and a lot used to this. Usually by a couple months of age, they aren't doing this anymore. They're just more used to being on their back. And if you are swaddling them up, that can help them be more comfortable on their back too. So it actually is safe for you to give your baby a pacifier. It actually is one of the protective mechanisms against SIDS, which is that sudden infant death syndrome. That's what we're trying to prevent with them staying on their back. So actually giving them the pacifier where they're sleeping is actually safe. So that is okay to do. And if you have like a fan on in the room, that can actually be a protective thing for baby also. We just want to make sure there's nothing loose in the crib as far as like pillows or blankets or anything like that where they could accidentally get their airway covered. So for caring for your baby's umbilical cord in the beginning, so it is normal for that cord to stay attached for a little bit. Usually it will fall off anywhere between a few days of life and a few weeks of life. That's typically the time that it will fall off. So sometimes it is pretty early. Not alarming if that does happen. Before it does fall off, it can actually smell a little bit. Sometimes it will have a little bit of an odor to it. Sometimes it will drain a little bit. And so that is okay. What would be abnormal would be if you noticed a redness to the skin around their belly button, especially if that's warm and spreading. Super uncommon for them to get infection there, but that would be a reason to seek emergency medical care. The other thing to note with the belly button cord is that once it does fall off, there is a little bit of a yellow, it almost looks like a little yellow gummy tissue, and that is normal. That is just what is there when it falls off, so it's not infection. And we just recommend not submerging them in a bath. So you want to keep basically that part dry if you can and do more of a sponge bath. So that just means you're kind of holding them out of the water, but using soap to clean the areas that you want to while keeping that part from getting wet while their belly button is healing, because that prevents infection. I also want to talk about care of your baby if they are circumcised. So there are different types of circumcisions, and depending on the type that they have done, that will determine the care that you need to do for them. So one of the common ones in this area is a placebel. So it is actually like a little ring that will go just around the tip of their penis, and that will just fall off on its own. So usually it will fall off about 10 days of life, and you don't need to do anything to it. It's recommended to not put Vaseline or anything on it like that. Same as the belly button cord, you do not want to submerge it in water until it has fallen off and it looks like it is healing. With that, I always like to warn parents, it does look gross. That's the only way to really say it looks gross whenever it is about to fall off. The skin around the outside will turn black, the string area that will turn black because that skin is just dying, and then the ring is gonna fall off. So sometimes before it falls off, there'll be a little piece of the ring that is kind of still attached. And so sometimes it looks weird because it's like sideways or crooked. That is okay. You just don't wanna mess with it. You wanna just try to let it fall off on its own to prevent any bleeding or anything like that. And so just let it kind of do its thing. And then once it falls off, you're done with it. And then at that point, once it looks like the area is healed, then you can go ahead and do regular baths. If they have a circumcision done that's called a Gomco circumcision or a Mogan circumcision, those will basically just look like the foreskin is removed there. So it will just kind of look raw. That little part where the skin is removed just on the top of the penis will just look raw. And so with that one, it is actually recommended to do a little Vaseline to the area, and you just want to keep that on as much as you can all the time until it is healed. Usually by about a week of life, it is healed and it's looking a lot better. But it is normal when it's healing to have a little bit of like yellow tissue on the top. That doesn't mean infection. It's just kind of that normal healing tissue, kind of similar to the belly button when it's healing. What would be abnormal is if you were to notice increased swelling or redness, specifically more down, like lower down on the penis is usually where we would see that if it is going to happen. And so that would be something that you would want to watch for. The best way I think to do the Vaseline is actually if you can just get a tube of Vaseline. It's easier sometimes to just kind of squirt it, and you kind of just want to squirt it like an ice cream cone. You're wanting to cover that whole area that is raw because you want to prevent sticking to the diaper, because that's going to help it heal faster, and it's going to prevent it from bleeding. So peeling skin is normal in babies. It is a question or concern that comes up a lot, and it's actually normal. So if you think about it, baby is used to just being in liquid, right? So when they come out, it's really dry out here. It's not the same as what they're used to. So their skin can be dry too. So that is very common. Normally their hands and feet will peel a lot, and that is okay. It's not harmful to them. It's just kind of their skin is getting used to being in this different environment. Usually around a month of age, this will stop. So typically it's just kind of that first month we'll notice the peeling more. If you want to use egg lotion on your baby, that is okay and safe to use. I think the best one most of the time is just like a Vaseline or Aquaphor, because it doesn't have a lot of any scents or additives in it that can cause kind of irritation in baby's skin, because they can be really sensitive. And so that's just an easy one to just have on hand and to use if they seem dry. When you bring baby home from the hospital, you really don't need to bathe them a lot. Once a week or so is okay in that first newborn period, because their skin does dry out easier, and they actually do better without having those frequent baths. And they're also not getting dirty. In the beginning, they're not, eating and getting food all over them and things like that. So it is okay to just do about a weekly bath in that time. So cradle cap is a common finding that babies can get. It basically is just, if you look at their head, they have just kind of this like yellow, almost like a little kind of crusty area, but sometimes it can look a little bit oily too. So it's very normal in babies, and it happens quite a bit. Usually with age, it will just go away. But if it is becoming a lot or it's kind of bothering you, some easy things to do are you can actually just get like an oil, like if you have at home, like an olive oil or a coconut oil, and just kind of rub that on their head, and then get a fine tooth comb and just gently kind of brush those scales out. And they probably will come back in the beginning. They kind of just recur, but that is something you can do to prevent it from being too much. And then with time, if your baby is, getting older and you're still noticing this, say they're like 6 months old, 8 months old, and you're like, oh, that's still there and it doesn't seem to be getting better, there are shampoos, prescription shampoos that your doctor can prescribe to help with that. But usually we try to avoid those in the beginning just because it is not a harmful condition for baby. And the shampoo itself can cause like kind of burning in their eyes. So usually something that we just kind of try to manage symptomatically, unless it isn't getting better with time or it's getting a lot worse. So when you're bathing your baby, it is important just to make sure that they are very secure, because since they are not supporting their head well, you're gonna have to do all of the support. So you're just gonna wanna make sure that they're safe and that you're gripping them very tightly, because when babies get wet, they get very slippery, and you wanna make sure they're not slipping out of your hand. There's different things that you can buy to help with bathing if you want to. There's little baths that will help them be a little bit elevated so their head is supported, so that you can kind of control where the water is. Some people prefer to just use like a little sponge and put that in the sink so that you can kind of hold them that way. So whichever way is fine, you're just gonna wanna make sure that they are secure, their head is supported, and that they're not gonna slip out of your hands. I just wanted to make sure to make it clear too that if you do have any questions or concerns that you aren't sure about your baby, or if something is worrisome to you, that you need to go to your medical provider and talk with him about that. I always feel that I call it the mom gut, but it is very important just knowing if something is wrong or not. If you feel that urgency to reach out to someone, you should always do that. I just wanted to give a little bit of encouragement to the parents that are taking care of young babies. So just having been there myself, I know that it can be just really stressful, and when you're in it, it just feels like there's nothing else going on and it's just overwhelming. But I just wanted to encourage you that this is the right spot, that God chose you to be this baby's parent, and that He has a plan to prosper and to not harm you guys, and He has a plan for good. And to just hang on to those truths during those times where it is easy to listen to the lies around you saying that you're not ready for this, that you can't do this. But the truth is that God chose you and placed you in this spot to be this baby's parent, and He will help you and equip you. When you lean on Him and seek Him for help, He will equip you. So I just wanted to encourage you to just press into the Lord in that, and to know that with His power that all things are possible and that you can do this. The Lord says in Isaiah in chapter 40 verse 11, it talks about how He gently gathers those in His arms and He leads those that have young. And that always has really encouraged me, that I might not know what I'm doing as a parent, but that God does know, and He leads us to lead our children, so that when we cling to Him and we trust in Him, that we can be the best parents that we can be, and that's what He's designed for us through His strength.